It was traumatic enough for Lisa to watch her mum have a devastating mental breakdown. But then, from the time she was sectioned, it took 12 hours for her local NHS trust to find her a bed. When they did, it was 2.5 hours away in an ambulance.
I felt guilty because I just felt that I wasn't there for my mum. I wasn't able to visit her. She had no one there to be with her apart from strangers, and that must have been appalling for her.
Do you feel angry about it?
I'm very angry about it. I think it's totally wrong. It's not in the nature of good quality care.
But Lisa's mum's case is by no means a one-off. We sent freedom of information requests to every mental health trust in England. 2/3 of those who replied had used beds in other NHS trusts last year, affecting hundreds of patients. Some of the hospitals were hundreds of miles away from the patient's home. But that only tells part of the story. 97% of trusts told us they use private providers for beds too. 12 spent more than £1 million on private beds last year. One trust spent £5.3 million.
So in the last few years, when you look at the statistics of the number of patients who've had to go outside their area, it's trebled. You look at the waiting times to find beds, that's been getting longer. And you look at the amount of money we're spending on out-of-area care, overspill to the private sector, all of it has been going steadily upwards. And this certainly says the system is under, I would think intolerable pressure is a reasonable way of putting it.
Professor Wesley told me doctors often spend hours calling bed managers up and down the country to find a safe place for patients who've been sectioned because they're judged a danger to themselves or others. Charities say the most vulnerable are being let down.
We've seen from both the government and the NHS a commitment to putting mental health on a par with physical health, but unless you've got enough money in the system, it's never going to be achieved.
And mental illness is often a long-term problem. Lisa's mum is terrified her experience will be repeated.
She is so fearful of being taken away out of area when she does have to be sectioned, or if she goes into hospital as an informal patient. It really frightens her, causes her a lot of distress, and I don't think she's forgotten that.
For too many patients, it's a frightening time, made even more painful.